Imagine you respond to a call for an 82-year-old patient, confused and wandering outside her home. The family tells you they have been forgetting things more often and sometimes don't recognize their loved ones. What you're seeing may be related to Alzheimer's. Alzheimer's disease is a progressive brain disorder that affects memory, thinking, and behavior. It is the most common cause of dementia. Patients may have trouble remembering recent events, understanding instructions, or performing daily tasks. Some common signs include memory loss, such as forgetting names, places, or recent events, confusion, getting lost in familiar places. Behavioral changes may include agitation, wandering, or repeating questions. Difficulty with communication, trouble finding words, or understanding conversations. When caring for a patient with suspected Alzheimer's, check for safety risk, wandering, falls, or inability to follow instructions. Obtain history from caregivers. Note any recent changes in behavior or memory. Monitor vital signs. Rule out other causes of confusion like low blood sugar or infection. Your treatment and care provide slow, reassuring tone. Treatment for Alzheimer's is mainly supportive. As an EMT, your role is to ensure the patient is safe. Communicate calmly, speak slowly, and use simple sentences, and maintain eye contact. Prevent further confusion or injury. Avoid sudden movements or loud noises. Transport safely. If the patient needs hospital care, bring along a caregiver if possible. Remember, patients with Alzheimer's may not understand what's happening around them. Your compassion and patience is just as important as your medical skills.